one of the key questions that we see all over our social media streams and we get asked about a lot is whether, as an IMG doctor, you should consider joining the BMA. So the BMA have kindly sponsored the conference today. You've seen the links in your registration emails as well as in the chat. And so in order to help you decide on that answer, that question, we have two fabulous speakers joining us today. To start off with, we have Dr. Anil Jain, who has many accolades to his name. He is a founding member of the Disabled Doctors Network and Workforce Disability Equality Standard Strategic Advisory Group. He is a member of BMA UK Council as well as the UK Consultants Committee. He is also part of the Equality, Diversity and Inclusion Advisory Group. He led by setting up the BMA National BAME Members Forum and regional BAME networks, as well as the BMA IMG steering group. So he's done a lot of work for IMGs, and it's a real pleasure having him join us here. And certainly I've worked alongside Anil in BMA meetings, and I know that he is a very vocal voice when it comes to IMG issues. So it's a real pleasure having him here. And alongside Dr. Anil, we also will have an IMG doctor explaining how the BMA has helped her as an IMG doctor. So Dr. Uche will be joining us. Uche, we can't see your webcam as of yet, so brilliant, there we are. So thank you so much for joining us. Anil, I think you've been given the presenter rights to host the slides.
Thank you, Pooja. Thank you for giving me this opportunity on behalf of the BMA as well as the Aurora Medical Education to speak. I'm a consultant radiologist in Manchester, and as you mentioned, have been in medicine for over 40 years, So in this presentation, Dr. Uche and myself will be working jointly. So I will make the start, and what I will be covering my journey as an IMG, as an international medical graduate, who came almost in 1989, and Dr. Uche, who came much sooner, So this will give a bit of contrast, in our journey. So next slide, please. Next, yeah, thank you. So I qualified in medicine in 1982 in Delhi, in India, and I did my MD in radiology in 1987 in Delhi. I came to the UK in 1989, March 1989. I remember it was really very cold. I took my PLAB exam in Edinburgh at the time. And one of the reason I came was my peer group, my colleagues were already here, and I just followed them. They came the year before, and I came 1 year after them. I was lucky to get a attachment at the Western Infirmary in Glasgow, and then I was able to pursue radiology registrar training, which I pursued from 1989 to 1992 in Glasgow. Then followed by, in those days, we didn't have SPR training. We had registrar and senior registrar, so there were hoops in between, and I managed to get a senior registrar post in Manchester in 93. So I continued there until 94, and I became a consultant towards the end of 1994. And throughout this time, I've been a member of BMA. And I think in my presentation, I will be covering, highlighting why it is important to be part of a trade union. What are the benefits, which I have felt myself, and which international medical graduate deserve, actually they very much need. Next slide, please. So the challenges, I faced quite a lot of challenges during my journey. One of the things which I was, when I was speaking to Pooja earlier, in those days, India was a relatively poor country, so we didn't have huge foreign exchange reserve. So I remember I had only 250 pound in my pocket, when I came to the UK, and I had made arrangement with my friends to pay back their family in India in rupees, while they were helping with my PLAB fees and the rest of the fees, So thankfully, some of you don't face those challenges now because India and Nigeria have good foreign currency reserve, So you are able to avoid those challenges, So when I came in, the first thing after the PLAB exam, you are given, I think you are given only 3 months visa to find a job, which can be very challenging in such a short time to find a job. And I think any visa given is linked to the job. So it was quite a challenging task. Each time you apply for visa, it costs you money. And I don't think that has changed, probably during COVID it was free, but maybe they I know it can cost quite a bit. Other thing getting used to is coming from Delhi, getting used to the cold weather, and I'm sure from Nigeria also it must be the cold weather here, in this country, which could be very daunting. Other issues, acculturation. When I went to Scotland, the accent was very different. I mean, like in India, there are so many different accents. In Scotland, the accent was very different from English accent. And I think, and I noticed that English people in Scotland were having difficulty, because the accent is very Scottish. So that another element, acculturation, getting used to, I'm vegetarian, getting the vegetarian food and those kind of things. Then I had my challenges with illness and disability. I had some back pain and managing that. I think the other important issue which doctors coming from abroad could face, and I did face, was bullying and harassment and discrimination, which I will mention a little bit more, where BMA roles will come, and obviously employment issues and BMA support as well. Next slide, please. So, I mean, I think you guys must have heard already that international medical graduate, they make almost 1/3 of the medical workforce. They are the backbone of NHS. And that number is increasing, year by year. From this slide, the purple bar on the side, it shows the number of international medical graduate increasing everywhere. This is giving a figure of 2020, 72,000. I think I would think now probably at least 75,000 international medical graduate are there in the UK. Next slide, please. And the number of international medical graduate is increasing. So GMC registration in 2019-20, IMGs were more than double the number of UK qualified doctors. And I think this gives, I think it brings out 2 points. One is that IMGs are backbone of the NHS, so they should be respected, they should be looked after well, and they should be given similar opportunity to local graduate. My son is a doctor, he's a local graduate, I have no issue, if international medical graduates are given in competition the same opportunity. Next slide, please. Now, the BMA conducted a survey. I think when we set up the IMG steering group, we conducted a survey. We wanted to find out why international medical graduates come to the UK. And you would think, and I think cynical people will think it is financial factors. No, financial factor is only small amount, because a lot of doctors now in India and Nigeria probably can earn quite a lot there, and in other countries also. So it is the career development that is the major issue. People come here, and obviously in case of women, they might get married, to a husband, and that might be the reason they want to come as well, along with their career development. So I think that is the very important aspect, and I feel that in our survey, 80% people said career development is the main key, and hence the in the BMA through the IMG steering group and IMG champion group, we want to create the same opportunity for international medical graduate as for the home graduates, and that is taking some time, but I think we are making some progress. Next slide, please. So the challenges, there are multiple challenges faced by international medical graduate, as I highlighted in my own journey: immigration system inflexibility, complexity in cost, setting up and navigating new life in systems, housing, bank account, employment advice. These are small things, but they are very important when you come from a different country with different systems, and considering that international medical graduates are from all over the world. So these challenges are not insignificant. Joining the overstretched NHS, I think that issue has become more, I think, more focused now, considering that the number of foundation year places are limited and other training posts are limited. So international medical graduates are essentially fulfilling gaps in the rota and the system. We want them to have the same training opportunity like our UK graduates, and I think that is a challenge for them. Adjusting to the new workplace culture, uh, inadequate induction, cultural differences and barriers, which I highlighted earlier, they can be very significant. And I think, I mean, now I've been here now for over 33 years. And I think when I came first, I was missing my home, family, and friends, And I think, and I remember one of the things which I want to share with you. In those days, making telephone call to India was really very expensive, So for 1 minute call, you could be spending £1.5 pound, So for 20 minutes call, you could be spending 27 to 30 pounds to make telephone call to India. So I'm glad that thing has improved, and I'm sure technology is making things easier for us. Next slide, please. IMG also face additional challenges. Almost you could say 2.5 to 2 times higher in each thing. That is the bullying and harassment, undermining. IMGs don't feel confident to speak up, and I think we'll hear from Uche about her experience. What she encountered. Then people couldn't raise voice during COVID pandemic, and 95% doctors who died in the first pandemic were BME international medical graduate. The challenge in relation to negative stereotyping and bias, and that is totally unacceptable in my view. You are looking after patients, you're providing the service to NHS, and NHS should look after you. There are other significant challenges in relation to differential attainment, with almost one-third lower average postgraduate pass rate, especially in MR, CGP, and other Royal Colleges exam. And then the thorny issue of disproportionate complaints and disciplinary proceedings. Again, those are the issues, which highlight why trade union membership is important. Next slide, please. And obviously, when you come as international medical graduate, 33 years back when I came, there was no induction at all. I mean, really, I think the medical staffing department was two helpful ladies, who were looking after. There was no induction in those days, and it wasn't mandatory. There was no GMC welcome to UK practice thing, and and I think it was basically you learn by falling, and this was quite a significant challenge. So hopefully things are improving. Next slide, please. So now I haven't spoken for some time. I bring Uche, and Uche completed a medical training in Nigeria, and and she's a GP trainee in Cardiff in Wales, and she is a member of BMA, and she has had positive experience with the BMA. So Uche, over to you now. If unmute yourself.
Can you hear me? Can you hear me now?
Yeah.
Hi everyone. My name is Uche Derek. I'm just like everyone here. I came to this country from Nigeria barely 3 years ago, and I've been in this conference. I've been attending since morning. So everything that all the speakers have been talking is also applicable to me. So basically, I'm just here today to tell you about the challenges I've gone through, the support system that are available for us, and especially how the BMA helped me. So when I started, as I said, I came to the UK 3 years ago, and I started doing locums. Then 2 years after I started GP training. So like everyone, I was torn between, should I become a BMA member? Should I not become a BMA member? Because it's not like mandatory that you have to be a BMA member. Fortunately for me, there was this period that there was this free sign up and join the BME member till October. So I just decided to sign up to see if BME was going to be beneficial for me. And that was one of the best decisions I made, because shortly after, out of the blues, I got a phone call from my training director that I'm going to be involved in an investigation. I had no idea what it was going to be all about. And the first thing I did was to ring my defense organization. When I rang the defense organization, they told me, sorry, this is an employment matter. You need to contact BMA. And I was like, oh, I just joined the BMA. Are they going to provide support? I've heard so many negative things about how unsupportive the BMA was. But at this point, I had no choice. I had to contact the BMA, and I contacted the BMA, and they said they were going to carry out an assessment to see if they were going to support me. So as I was waiting as the investigation was going on, I was waiting for the BMA to see if they were going to support me. I had to carry out some research on my own. I contacted the private defense organization. I was like, in case BMA doesn't help me, because everyone was like, forget it, BMA is not going to help you. In case BMA doesn't help me, let me see how much it was going to cost if I was going to engage the service of a private defense organization. Because my defense organization told me, this is serious. We don't think you should defend yourself. You need a defense organization, which is BMA. So I went privately and contacted some private defense organization, and the money they called was astonishing, and I knew I couldn't afford it. I had no other choice than to keep my fingers crossed and to see if BMA was going to help me. Unfortunately, when I got the email that there was going to be an exception and they were going to take up my case, I was overjoyed. I thought that was the best part of it. But actually, when I met the BMA representative that was assigned to my case, he was really, really supportive. He's the best thing that has happened to BMA in my own words. So at the beginning of the conference, one of the speakers talked about the tone when a complaint arises. You'll be feeling angry, you'll be feeling frustrated. But the advantage of the BMA is that when I told my BMA representative my story, he practically told my story in a way that my organization will understand. He removed the way, if I were responding to it, I would have been protective, I would have been defensive, but he taught me, and he taught me how to respond in the NHS way. So fortunately, and also when I was waiting for the investigation, I tried to do it on my own. I sent some emails to the investigation body. I was requesting for some information, and they didn't respond to me. They were not forthcoming on any information. They were like, sorry, I can't give it to you. But when I had the BMA representative, immediately he sent them an email on the same queries which I asked them. The next day, just like lightning speed, they responded. I was marveled. I was like, wow, if you are trying to go through an investigation on your own, that's the worst thing anyone can do. So fortunately, because I had a wonderful BMA representative, at the end of the investigation, the outcome of the investigation was no further action, and the case was going to be dismissed. So I was very happy that this was the end of the investigation. But my happiness was just short-lived, because weeks later, because my training director, they referred me to my employers, and my employers carried out the investigation. So when they sent back the reports to my trainers were not happy with the outcome of the investigation. They decided that they were going to refer me to the GMC. So when I heard this news weeks later, I was devastated. I was from 100%, I went down to 0. I had no hope. I didn't know what to do. If I were back home in Nigeria, what I would have done, I would have started making phone calls. Who do I know? Who is the contact? What connections do I have that will get me out of this mess? But in the UK, the only connections we have here is the BMA. So fortunately, during the meeting, I was in the meeting with my BMA representative, and he saw how devastated I was. And he sent me an email, don't worry, I will try and see if we're going to stop this GMC referral. I was like, I didn't believe it. But I was too low to even know what was going to happen. The next day, just like my hero, Chris is my superhero, is my Superman. By 9 o'clock the next day, he told me that he had gotten a meeting with he had gotten a meeting with the responsible officer, and he's willing to put on hold the GMC referral, and he wants to have a meeting with me so we can discuss things through. And true to his words, after I had the meeting, the GMC referral there was no referral made to GMC again. Now, I would not have gone through the first part or the second part or even the third part if not for BMA. Now, when I started, they referred me, oh, you can speak to your defense organization, you can speak to professional support unit, you can speak to the BMA. But in all these people, if I was not a member of the BMA, I'm sure I would not have been here today saying I am still a GP trainee. But today, I'm still a GP trainee because I'm a member of the BMA. So my advice to everyone listening now is that if you are at that crossroad and asking yourself, should I become a BMA member? For us as IMG, one of the things, like Anil said, one of the reasons why I made the mistakes I made was because I wasn't confident speaking up. I couldn't get the right information when I needed it. I made mistakes. And the induction, I started my GP training during COVID. Induction was just next to nothing. So I was lost. And because I am new to the system, because we are new to the system, we will make mistakes. And if we don't have the connections, like back in Nigeria, you need somebody up there. And if we don't have the BMA as a defense organization that is covering us, that can turn reverse our fates when, like in my case, it was going negatively, then I don't think that we can even afford a private defense organization. So in summary, I'm just here to encourage each and every one of us that we should try and click on the link. Please be a BMA member, BMA member. There's a reduced fee, I think, for new doctors new to the UK, and it's really pays, because if you try to pay for a legal representative when things go wrong. I'm not praying that anything is going to go wrong, but if things do go wrong, we can't defend ourselves. We can't tell our stories the way they will understand. It's not possible. We can't do it. We are new to this environment. We need help, and the help we need is BMA. Thank you.
Thank you, Uche. Thank you. So let's go to the next slide, please. So supporting international medical graduate is a BMA priority, and colleague like Uche, I think this is our IMG steering group work started in the beginning of 2021, during the pandemic, most of the work started during that time. And as I mentioned, 1/3 of international medical graduate are not BMA member, are BMA member, 2/3 are not, And I think the point is that international medical graduate like Uche, they need more support than the local graduates. And I think that's the critical bit. And in my home country, as doctors, we didn't have anything like trade union. Here we have BMA as a trade union. And as Uche mentioned, there are various membership category, for especially for international medical graduate junior doctors to get into the system, but also we'll be showing you later on a link to the there is a Pooja has kindly Pooja Naman put a link in the chat bar. If you open that, that takes you to the link to the international medical graduate affiliate program, in which the international medical graduate could link with the BMA right from where they are, before arriving here. So I think what else the BMA did, the IMG champion group, which I co-chair with another colleague. There is a locally employed doctor toolkit, and I think apparently there are something like 12,000 LED doctors, and most of them are international medical graduate, and they need our help. They're developing employment advice and support for international medical graduates, meeting our IMG graduates in various meetings at the trust and in GMC welcome program. And I think we also send a dedicated IMG newsletter. So you will get a newsletter in which you might see my photograph, and you will see some blogs from colleagues. You will see a lot of helpful information. Next slide, please. And I think other important aspect is that BMA is a large organization with something like 160,000 members. So it is the largest trade union of doctors. And you can see a blog myself, which I published. Risk assessment are more important now than ever, And I think during COVID pandemic first wave, a lot of doctors who died were international medical graduate. And I fought really hard for the risk assessment, for better PPE, and subsequently for vaccination. So we need voice of international medical graduate nationally to raise the issue, to profile of international medical graduate, so that some of the challenges we are facing, we need advocates, we need people, who could argue on our behalf, and that's the BMA can provide that. Next slide, please. So we look after you, and so that you can look after patients. That's the slogan of the BMA. And there is a, you can see a scan code on the right side, which if you scan, it will take you to the international medical affiliate form, which you can complete. So it is a trade union for doctors and medical students. It for all specialty, GPs, hospital doctors, SAS colleagues, public health doctors, retired doctors, you name it, and all the doctors are part of the BMA. And BMA represent our doctors nationally and locally. Individual employment support, like in case of Uche, Christopher Saunders, BMA employment advisor, supported her. And there is also a lot of professional development, which BMA provides, and which I will mention in the next slide. Next slide, please. So I think how the BMA is helping is, one is immigration advice service, and there was something like 700 immigration queries last year, and I think BMA can help with representation of their behalf. If there is legal advice needed, they can also arrange cheaper legal advice, So there are a variety of ways BMA can help. They can also help draft, various things, So BMA is vital for immigration advice. Toolkit for doctors new to the UK, which include various things, which Uche mentioned, and learning resources, that is really very important, that when you come from country like India, Nigeria, Egypt, so the BMJ, the British Medical Journal, is a essentially part of the BMA, BMA is 200-year-old organization, and BMJ is part of it. And BMJ has 1,000 learning modules which have softer skills like communication skills, negotiation skills, you know, uh, and basic clinical portfolio also you can build. You can do all the courses, and you can do them even while not working. You could do all those courses online. There is access to free conferences, free development workshop, interview skills, and CV checking, which I mentioned, like 75 to 60 pounds for BMA members, which is not really very expensive, for checking your CV and for one-to-one career advice, and a specialty explorer also. Next slide, please. And I think really BMA is here for you when you need. And I think one of the things I've been doing at the IMG Champions Group and Steering Group is that when our members are not getting the right advice or support, then they can flag it up, And I think that's the structure I'm trying to build, so that IMG have advocates within the BMA. They can approach through the system. And if they are not getting the support they need, we can flag it up, In case of Uche, obviously she got the support locally so well, through the industrial relation officer, employment advisor, confidential emotional support, like the GMC procedure Uche mentioned. If we had gone to that, then BMA well-being support service, and thankfully didn't go to that. But if it had, she would have had that support, as such well-being support, like if you have bereavement in the family, and during COVID-19 we had member of international medical graduate who died here, or they had family death in India or Nigeria or elsewhere, or Egypt, and in those cases they can access free counseling service. I took BMA counseling service in 2018 when I was ill, and I think it is absolutely important, and that service is completely free, and confidential. And the BMA also give grants to for financial hardship through BMA charity, especially for refugee doctors, doctors coming from Myanmar, coming from Afghanistan, and now Ukraine, from other countries. BMA help with that as well. Next slide, please. So, I mean, I think you can see the example that there was something like 151,000 queries, 70% were resolved through the first call, first point of call. But I think just like Uche mentioned, the complex queries will require an advisor, to work with the member to sort out. And the queries could be like underpayment, contract checking, working too many hours, compensation, annual leave, study leave, or for example, conduct issue, like the sort of thing, Dr. Uche faced. Next slide, please. So here comes the slide. So if you scan this code, and you will get the affiliate program form. So this international medical affiliate program, I'm part of the task and finish group. And what we are trying to do is set it up so that international medical graduate, before they come to UK, they can join this affiliate program at a much cheaper price, get access to variety of benefits, which you will know once you register for it, like, for example, access to BMJ, learning modules, and variety of things. And when you come here, you again get discounted rate to join the BMA. So you become part of the system. So please have a look at that. And I think I know we run a little bit over time, so happy to take any questions now. Thank you. Thank you, Pooja Naman. Thank you.
Thank you, Anil. Thank you, Uche, for sharing that very personal experience of yours, which couldn't have been an easy time at all. So really appreciate you sharing your experience. Quite a few of you have got a little bit confused with the terminology, asking how the BMA differs from indemnity providers. Essentially, as Dr. Anil has mentioned, the BMA is a trade union, supports you with your employment related issues, and so is one of the support systems that really, as an IMG doctor, you should consider alongside your indemnity providers. So indemnity providers are someone who help you in relation to complaints and can provide you with legal support, whereas the BMA is a trade union and tends to help you with employment related issues. So they are two very different organizations, and a lot of people would urge you to have both. In terms of questions, I think Dr. Anil and Dr. Uche they've really answered most of them. I'll come on to them in a second. Some of you are asking in regards to the code. So as Dr. Anil has mentioned, it's the same code and link that I've posted in the chat. It's simply a sign up form for you guys to sign up to find out more information in relation to the affiliate membership. It's a new scheme being launched by the BMA. Previously, you weren't able to become a BMA member whilst you were abroad. This is something that Dr. Anil has worked alongside other members of the BMA to push for some sort of scheme to help you even before you come to the UK. So a lot of you are asking how to build on your CV, how to get CPD. So Dr. Anil has listed some of the benefits there. A question in for Dr. Uche, if that's okay. In regards to the membership pricing of the BMA, if it wasn't free, would you still recommend joining the BMA?
Well, thanks for the question. At that point, I was torn. I said I've been in this country for like let's say 2 years before then, and I wasn't a part of the BMA. So that's free, join the BMA free. That was what pushed me into joining the BMA. I was like, let me be a member and see the benefits and weigh my decision if I should continue or if I should not continue. So fortunately for me, during that window, I had a push to make me to become a BMA member.
And Uche, firstly, thank you both for that. That was really helpful, and Anil, some really clear points there. And Uche, your story, I think, would have resonated with a lot of doctors listening in. But Uche, just following on from that question from Pooja, since you did sign to the BMA, and obviously you used them in that particular period, and they were very useful for you, how else has it benefited you since then? Have you used any of the other things they offer for you since that point?
Yes. So the support system. So when I was going through this process, you can ring them up and you can speak to someone 24/7, and I did that. And also the BMJ journals, which they send every time. So I always go through that. So those are some of the supports that I've used since then, and I keep using every day.
Great.
And another question that's come in, sorry, they all seem at this moment in time to be related to Dr. Uche. I'm sure, Anil, if a general BMA query comes up, I'll put it your way. But
can I add something? I was just going to add, that the trade union aspect of BMA, along with the individual membership support, is also negotiating for members, like their contracts, their terms and conditions, their pay, those are really very important aspect, so that aspect of BMA nobody else has, so BMA is the main trade union for doctors, including GPs, hospital consultant, SAS, so that aspect is really very important. I know there is the smaller union, but I think that aspect is really critical, so the individual employment support and negotiating on your behalf, so that is very important. I just wanted to mention that.
Thank you, Dr. Anil. So, Dr. Uche, someone's put down there is a lot of financial burden in the process of coming here to the UK. In hindsight, would you still consider joining the BMA even before coming to the UK?
When I wrote my statement, when I went through this process, one of the things I flagged up to the BMA was that the major reason why IMGs don't join is the financial burden. Exactly at this point, that's what I raised. Because when we are coming in, there are so many things we need to juggle. There are so many financial commitments. And when you think about BMA membership, you're like, is it really worth it? Can I just push it further? Just like I did. I kept pushing it until it got to a breaking point. But it's just like a car insurance. It's like as essential. It's like essential as like your life insurance, car insurance, anything. Even though it's not comfortable, you bringing out the money. It's something that it's not a should, is a must, because we're IMGs, we're going to make mistakes, and you don't have any other source of help if you don't have help from your defense organization and BMA. You can't turn to any other person for help or for support. That's basically all the help you can get. And if you don't have the membership, the alternative that's going private is something that's going to cripple you more than the less than £20 a month that you're going to be coughing out for membership. So I think it's worth every dime being in the BMA membership.
Sure. And Dr. Anil, I think the aims of this affiliate membership is that it's going to be less than £20 a month. Do you have any idea of costings, or is it best for them to just click on the link and sign up and you'll forward more info?
I mean, I think it is best to click on the link, and get explore the benefits. The program is being developed at the moment, so I think the aim will be to keep the fee as low as possible, so that everybody can benefit that. I would just wanted to add one more thing, which I think, Pooja, you mentioned the indemnity aspect, that in the NHS, all NHS doctors have crown indemnity. Now the GPs also have crown indemnity, but I think the indemnity you need is for certainly for training doctor, junior doctor, is for if you become subject to GMC investigation. That's where the indemnity element comes really helpful. If there is a complaint against you, clinical complaint against you, then the medical defense organization can step in, because the BMA doesn't get involved into clinical issues. Clinical issues are looked after by the medical organization. In case of Dr. Uche, thankfully they managed to sort it out informally without going through the GMC system. If it had gone beyond that, then BMA wouldn't have been able to help her. Thank you.
Okay. So thank you ever so much, both of you, for taking out time to speak with us today. Dr. Uche, you kindly mentioned that you've been here from the morning. As we're wrapping up and you've been with us all this time, do you want to shout out some of your favorite talks from today, and anything that you think we could possibly include in our future conferences? It's always great to have a speaker give their insight.
Well, I think my best speaker was Dr. Imon. She was amazing. I was just rooted. I was like, wow. I was like, I think I'm going to be like her in a few years, because I'm going through challenges. I'm going to persevere. I'm going to be different. I'm not going to blend in. So that was my thing. That was the highlight of the conference for me. And I think you should keep bringing her back.
Well, in a few years, we'll need to call you back, Dr. Uche, if you're going to be following the same path. So, but no, thank you ever so much for your time. Amin, do you want to say anything to wrap up the conference?
Yeah. I mean, I was going to say the same thing with Jay. I mean, it's been amazing that you've been here since the morning. You deserve to get some off-screen time now for the rest of the day. But thank you for your input and your story. I think that was very important, just to see an insight as to how you were helped by the BMA. And thank you, Anil, for your detailed presentation that covered all the key points that are often asked about.
I was also going to say at the last slide, I've given my email address. So if there is any query, if your attendees want to email me, that's a BMA email address. They can email me, and I will be happy to take up any queries.
Great, and we'll try and put that in the chat as well, actually. So people can...
Yeah, I'm also happy. Any clarifications? I'm also happy to take any questions.